Hello everybody, in this video we are gonna review some basic aspects of Bracken Fern poisoning, which is caused by the consumption of Pteridium aculenum. So there are like different syndromes, and these syndromes are gonna depend on the dose, the duration of exposure, and also on the species affected. So we have basically four syndromes, which are enzootic hematuria, hemorrhagic disease, bright blindness, and Bracken staggers. So the first one, which is enzootic hematuria, is the most common one. You will see that in cattle and sheep, and you will see this syndrome mostly in late summer. This is caused by a long exposure. It could be weeks to years, um, and you will see hematuria, anemia, hemorrhages, and all of these are caused basically by the consumption of dactylocytes, which are radiomimetic components that damages the bone marrow and are also carcinogenic. Unfortunately, once an animal presents with the clinical disease, it's usually fatal. So that's the first syndrome. The second syndrome is the hemorrhagic disease. This one is compared to the enzootic hematuria. This one is when the animal consumes high doses in a short duration. So what you are gonna have is a spontaneous bleeding, and that's caused by the depletion of megakaryocytes from the bone marrow. So you will also see hematuria and proteinuria. The third one, and this is mostly seen in sheep, is the bright blindness, which are that the animals are permanently blind with an alert attitude. So in the eye examination, you will have tapetal hyperreflectivity, which is a common finding. And you will also have to keep in mind that you will see other signs too, like these ones before. The Bracken staggers are more. It's mostly a neurological disease in horses that you will see with anorexia, weight loss, incoordination, trembling muscles when you try to move the animals. In some severe cases, you will also have tachycardia, arrhythmias, and the death of this animal is usually 2 to 10 days um, after the first clinical signs. Before that, you will see convulsions, clonical spasms, and opisthotonus. It's very similar to thiamine deficiency, so in some cases, administration of thiamine is useful. So this is important to keep in mind.